Starting prayer. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti. योगा गणपति मूल मंत्र. ओम हम संगम भगवते नित्य योग युक्ताय सच्चिदानंद रूपिणे विनायकाय नमः. श्री दक्षिणामूर्ति प्रार्थना. ईश्वरो गुरुरात्मेति मूर्ति भेद विभागिने व्योमवद्व्याप्तदेहाय दक्षिणामूर्तये नमः. स्वामी विवेकानंद प्रार्थना. नमः श्री यतिराजाय विवेकानंद सूरये सच्चित् सुख स्वरूपाय स्वामिने तापहारिणे स्वामिने तापहारिणे. Samarasya prayer for harmony from Rigveda. Om Sangachatvam Samvatatvam Sambho Manāamsi Janatam Deva Bhagai Yatha Purve Sanjanana Upasate Samano Mantra Samiti Samani Samanam Manasah Chittamesham Samanam Mantram Abhimantrayevaha Samanena Bohavisha Juhomi Samani Va Akutihi Samana Hridayani Vaha Samanamastu Manaha Yatha Vasu Sahasati. Panchangam. Aditana Panchangam. Saptavinshatyadika Ekashatotara Panchasahasrama Kalyugabdaha Shri Vishwavasu Nama Samvatsaraha Uttarayanam Grishma Rituhu Jyeshtha Masaha Shukla Pakshaha Trayodashi Titihi Vishakha Nakshatram Shiva Yogaha Taitula Karanam Induvasaraha. Today's date 9th June 2025 Monday. Tithesha Shriyamapnoti Varadayusha Vardhanam Nakshatra Dharate Papam Yogadroga Nivaranam Karanat Karya Siddhischa Panchanga Phalamuttamam. Sarvesham Shubhamastu.
Namaste everyone. June is the month of spirit of IDY. So in this spirit of IDY, Karma Yoga should be a part of all of us. So in Karma Yoga, Dhana has one of the important role. Shramadana, Vidyadana, Annadana. The important one for health, it is Raktadana. Today we have a pathologist from NH, Mr. Dr. Girish. Girish sir has completed his MD in pathology from BMC. He previously was the faculty at Shumoga Institute of Medical Sciences. From past 11 years, sir is working as pathologist at the blood bank of NH. So sir is here to create awareness regarding the Dana of blood, the Rakta Dana. I welcome Giri sir to take over the stage.
Good morning, everyone. How many of you have donated blood already? Can you please raise hand? Thanks a lot. A good number of you already donated blood and you are safe and healthy here. So it means to say that blood donation is not going to harm anyone. So if the blood donation is not going to harm anyone, is there any problems with the blood donation? There are no harm or no problems by donating blood. So only thing we need to show that, so blood donation has to be done after strict criteria to prevent any adverse events. So why is the blood required? What are the use of blood? If we collect the blood from you people, what will you do out of it? These bloods are required for the patients. Which type of patients? The patients can be children who are undergoing cancer treatment or who are suffering from blood disorders like thalassemia, sickle cell anemia, where there is no fault of them. These children are not having any fault of them, even then they are suffering from some diseases. These diseases can't be cured completely until unless the bone marrow transplant is done. So they need to survive every 15 days once, the life, they need to be transfused with the blood products. If these blood products are not there, they are going to have a slow death. To prevent that, these children need to get the transfusion once in 21 days or 15 days depending on their disease. Second thing is road traffic accidents. Whenever the road traffic accident happens, there is a mass casualty or depending on the persons, there will be a lot of blood loss. Sometimes we have issued nearly 100 units of blood for a single patient also. The third important reason is pregnancy. During pregnancy, there is a lot of requirement of blood if complications happen. If normal, nothing will happen, then there is no requirement of blood. But if there is any complications, there will be severe hemorrhage of blood, so which requires blood. So the fourth is the surgeries. Because of multiple different types of lifestyles, we are already faced with diseases. You people are lucky to stay here in the environment which is very close to the earth and where lots of trees are there. In the other side of the Bangalore, we live where there are trees are hard to find. All of pollution. The food is polluted, the water we drink is polluted, all of it contains plastics, and whatever we eat, we don't know. Healthy food, no one wants to eat. Everybody wants to eat pizza, burger, and the walking or the exercises what we used to do before, nobody is doing now. So everybody is a sedentary lifestyle. Even if you want to go to a grocery shop very nearby, which is just half a kilometer, everybody takes a bike or scooter. Nobody wants to walk. So because of all this, there are lots of cardiovascular diseases, heart diseases, lung diseases, and vascular diseases are cropped up. To operate these, again they go to hospitals and then they get the surgery done. During surgeries, these major surgeries requires lots of blood. For all these conditions, we require blood. So based on this, the Indian population or the requirement of government of India has estimated nearly 14.1 million of bloods are required. Next slide. Nearly 14.1 millions of blood is required for Indian population. So every 2 seconds, someone somewhere in world requires blood. So the blood is essential. But as we can produce because of AI and a modification, are we able to produce the blood? Right now, they are doing experiments, but we are not at 100% successful. Here and there, 1 or 2 cases we are trying to achieve, but it is not successful. So the blood has to be given by human beings only. If one human beings are eligible to donate blood, if they donate, they can help the others. So initially whole blood was collected and then it was given to as a whole blood only to the other patients. Now because of modification, what we are doing is we are collecting the whole blood and we are separating it into 3 different parts. One is platelets, one is red blood cells, one is plasma. Why we are dividing these 3 components? Because it can be better utilized. So all the components may not be required by all the persons. So we are dividing it into 3 components, major components, and we are giving it to 3 different patients. So that each blood donation is going to save 3 lives. Next. So this I told you already. Next. So what are the benefits for you if you donate regularly? Once in a while, if you donate in your lifetime 2 times, no benefit as such. So when you donate regularly, the cardiovascular system is regularly screened and the chances of heart attack are reduced. The excess iron in your body is taken care or it is shed along with the blood. The excess of cholesterol is taken out, and because of this, the cardiovascular risk like heart attack, stroke are reduced. So what other benefits? Since you are donating blood, it is going to save 3 lives. So many a times in the blood donation camp only we have identified hypertensives, or sometimes whenever we do parallel health checkup scans, the diabetes patients, or many of the females we have identified as anemic patients. Why they are anemia? Because the requirement for them is more, but they are not eating a healthy food. Because as Dana sir told, Dana is important. The females of the household, they are the major ones who do all the work and they feed everyone, but they don't feed themselves. So I request all the females here to be healthy first. If you are healthy, then you can take care of your family. So eat well and feed well also. So then only you can become healthy. If you are sick, you are only one person going to sick. Entire family is going to suffer. So to avoid that, all of you eat well, be healthy, and then only you can come for blood donation also. So before donating, who all can donate blood? Everybody of you who was here can donate blood? There are some restrictions. So as per the guidelines, more than 18 years you should have completed, you should become major to allow or give consent to give your blood. Second thing is, age upper limit is 65 years. What else we check? We are taking blood, so we need to check the hemoglobin content of your body. So if it is more than 12.5, only then you are eligible to donate blood. If weight is more than 45 kgs, you are eligible to donate blood. If you are not undergone any surgeries in the last 1 year or 6 months, then you are eligible to donate blood. And if you are not suffering from fever, cough, cold, then you are eligible to donate blood. So in this earth, we all came crying. When the first day when we came to earth, we came crying. When we go from here, after doing all the work or no work, others will cry if you have done a good work. In between this small life, I ask you to make your life happy and others' life also happy. One of the ways in making this life happy is by donating blood only if you are eligible. So please get yourself eligibility and donate blood. So you need not come anywhere. We will only come here tomorrow on 10th. We have a blood donation camp in your campus, at your place, at your convenient time. Please come forward and donate blood. So whenever you donate blood, there is no harm is going to take place. So small precautions, what you need to take is have lots of liquids, a good breakfast before coming for blood donation, and a good sleep in the last night. So don't stay awake for a long time or don't keep on scrolling mobiles, and please come forward and donate blood. So if any doubts are there, if any clarifications to be given, the doctors will be available at the site and we will help you out. So any questions, I am ready to answer.
Sarve bhavantu sukhinaha, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukha